Start with the next session. So can I invite the next set of panelists here? We have David Wilcox, who will be moderating. Shelly, Dr. Batra. Abhijit, I can't see you. Jasraj, can I ask you to sit? Manish, please. Thank you. Okay, awesome. So we'll just start the session here. We have a very interesting panel now. I believe this is going to be a great follow-up from the previous sessions that we've actually had in the morning. I think we just had a stunning session in the morning with Swamiji, Sadhviji, Suresh Prabhuji, and of course, and Mark. So it was just absolutely stunning that we actually had today. But I must really proudly welcome David Wilcox, who's the Managing Director for ReachScale, who's come all the way from Boston. We have Vinod Budhankar, who's from Sagar Mitra, thank you. Rima Nanavati from Seva. Seva is like self-explanatory, one of the finest organizations that you might have seen in the country. Abhijit Banerjee from Finnish Society, Shelly Batra from Operation Asha, and Susan Beverly, who's again come all the way from US right now. In fact, she landed at 1:30, I think. She's still awake, and hopefully she does not sleep on the panel, but thanks a lot, Susan. Thanks a lot, everybody. David, over to you. You have exactly 35 minutes.
Thank you. So to keep with the tenor that has been here this morning, which I have found delightfully refreshing, I'd like to ask everyone to close their eyes. And I'd like to ask you to think about two things. I'd like you to think about being fully intentioned around maximizing the potential of every individual in India and maximizing the potential of them creating value. And at the same time that you're fully intentioned around that, I'd like you to clear your mind. I'd like you to have a don't know mind. And I'd like you to try to keep that don't know mind and that intention together during our session. So a moment of silence to accomplish that, and then we'll start. I'm not going to talk about these people's credentials, even though they're some of the most credentialed people in the social sector. I'm going to use the time that we would normally talk about their credentials to tell you that their credentials don't matter. I'm going to ask you as they speak to feel the vibration that comes from them because they are not conflicted. You have in front of you a group of people who are quite unusual. The conflictedness that we've talked about in the earlier sessions, they have figured out a solution to, or many solutions to, or struggled with until they let go of the stuff that was conflicting them and put themselves in a position to do things that weren't conflicted. That's a unique thing. It doesn't happen very often, and you have a unique opportunity to hear from them, and I want you to feel their vibration more than what they're saying. And the don't know mind is helpful in doing that. If you went to Vinod's website, you would see a bunch of pictures of children with a few adult leaders, and you would think it's a WASH society or a training program for kids where the adults are telling them, how they should be better people. So I'm going to ask Vinod to begin the session by explaining what the children do in the Sagar Mitra world and how the children play a role quite different than the one I just described.
I respect the 120,000 children because of whom I am here, so I will stand and speak to you. This is not necessary for my colleagues. I'm not imposing it on them. I stand here because in a school called Vidya Bhavan in 2011, 150 children decided that they will live a value which is perhaps the most important value. Because we are here to share values, I saw that when we showed them a 1-hour PowerPoint presentation about how the birds and the fish are dying in the sea en masse, when we showed them that a metal axe kills the trees, and last 30 years, the teachers have been teaching the children not to use that axe on the trees. And we said every family throws plastic, and that is an axe on the birds and the fish. Within 1 hour, they understood and they said, what do we do about it? What we found is when you share a global problem with the children today, they are so sharp that they say, I will be responsible for this. I will be responsible for this. So their question was, what do we do? So we gave them a very simple action. The whole magic of our program, which grew from 150 kids in 2011 to 10,000 children, to 61,000 children, to 90,000 children. And now we have 94,000 in one city alone, Pune. And 1,20,000 is what we have across 5 cities. The magic of the recruitment of this program is we give them an action for which no capacity building is required. Firstly, the children are compassionate. They respond to the fact that the fish and the birds die. They see their pets in those fish and the birds. They respond by saying, I will do something. And we say, only in your house, only in your home, pick up the dry plastic and keep it aside. We don't give them the responsibility of washing anything. Most important, we don't ask the children to pick up from outside their house. एक वाक्य में हिंदी में बात करता हूँ, बड़े लोगों की औकात नहीं कि छोटे बच्चों से कहे बाहर से कचरा उठाए. Because we shouldn't tell the children to pick up from the roads because there are hypodermic needles there, pieces of glass there. The moment we told the children that you have to clean up your house, we didn't say clean up the city, clean up the country, clean up your house, bring the plastic to school. Once in a month, they bring the plastic from home to school. It gets collected there, and there they realize the value of working like an ant. If you have 2,000 children and each brings their own packet, we had a school last month bringing in half a ton of plastic. Half a ton of plastic, 1 ton of loose plastic will fill up this room. So you can imagine how much they got. So each ant working only in its place, not eating the sugar but carrying it where it should be carried. So we call this at the ants model where everyone has to participate. And the children have done it very well, and because of their example, the other children are emulating. What happens to the plastic we buy it? What we did is we tied up with the plastic industry, and we found that they felt responsible for the birds and the fish. Because the plastic industry is being pointed out and blamed for polluting. And so they find it within their value system now, a shared value that if we are also seen as manufacturers of plastic, and participants in empowering the children who bring the plastic to recycle it. So we have 2-3 plastic manufacturers who have agreed to buy the plastic back. So the children realized this was never a garbage problem. It's a mixing of 2 raw materials. If a child gets 1 kilogram of plastic from home, he saves 160 kilograms of garbage from becoming garbage. The rest of it is wet and changes to soil if you remove the plastic from it. Now once the children realized this, they continued. All that is there in this program is the scaling up of it. Like I told you, we started with 150 children, 10,000 children, 61,000, 90,000. Now we have 1,20,000. We are already in 5 cities, and our aim is by 2019, we want to scale this up to 150 cities in India and at least 50 countries. We have already started in 3 schools in New York in September. In October, we started in 3 schools in Morocco. In January, we are starting in 5 more schools there. We have started Global Internode as a central organization to manage the entire Africa operation. We will be in every single school. In my city, by 2019, we will have 1.2 million children doing it. We have 1,200 schools, and 1.2 million children will do this regularly. One of our students is here, Rujul, her principal is here, Gitanjali. They will tell you also, Rujul will tell about this program. The point I want to make is, please look at this. The value that these children are imbibing is personal responsibility. Only and only personal responsibility. When they come to school with their own bags, they realize what is community responsibility. And they are realizing that to serve the oceans, because we call these children as Sagar Mitra, friends of the oceans, Azdike al-Muhayt, friends of the oceans. So what happens is these children, through the vehicle of learning personal responsibility, are learning that together we can achieve so much that they are not just collecting plastic, they are collecting children. The 150 children who became responsible collected 94,000 children in my city who are responsible. Look at this, they are not collecting plastic, they are collecting children. Our aim is by 2025, 1.2 billion children. This is written and we will do it. What we need is support from all parts of society. Thank you.
Thanks, Vinod. I don't think I need that. Okay.
Did I finish in time?
This is what corporations would call. What would corporations call this? they'd call it leadership development. Think about that. These kids are leaders. These children are going to lead their parents. They're creating innovations out of their parents. Their fathers who run businesses are organizing their businesses to join their children. We have to start. So I'm guessing that virtually every person in this room in the past few months has heard close to a dozen statements in meetings like this about women's leadership, about how important women are to shared value, how important women are to the Sustainable Development Goals. Probably half of you have made the statement from the podium yourself. So what you have the opportunity now is to hear from the people who invented it. But they invented it 40 years ago. Ms. Bhatt and the people who followed her, like Rima Nanavati, they saw this decades before the rest of us saw it. So Rima, tell us what you saw and how you brought this forward.
Thank you so much, David. And today I speak here on behalf of 2 million sisters of Seva who have been the source of strength and inspiration for me. And as you were asking that, what made us believe in these women. And every time I was challenged with a dilemma or there was a struggle, and I would go back to our sisters and they would all be so hopeful, full of optimism, and that would make me think that, in spite of them struggling day in and day out, they are still so full of hope. Why are we getting frustrated? And that is what re-energizes us. And that is what is the faith that we have in the leadership of the women that we work with. We at Seva come together as women, as workers, and as poor, no matter what caste or community or religion we belong to. It is the sense of sisterhood, it is the sense of solidarity that helps her build her inner confidence, and that gives her the needed space to bring out her, leadership skills and capabilities. So I think it's the enabling environment. It's the sense of solidarity. Just to give a small example of one of our leaders, Jamuben, a completely illiterate embroiderer from a very far-flung remote desert village. And she was challenged to travel to New Mexico all by herself. A woman who had never even ventured and traveled to Delhi or to Mumbai on her own had to travel to New Mexico. And she said, when I asked her that, how was the whole experience? And she narrated that, I was really very nervous and afraid. But every time I felt nervous or afraid, I would tell myself that I'm not going to New Mexico for myself, but the lives of 30,000 embroiderers like me hang on my one visit to New Mexico to participate in the international folk art market. And that gave me the strength and the courage. So armed with just a piece of paper with the names, the telephone numbers, and the addresses, she traveled to New Mexico, participated in the exhibition, returned back, and she came back a completely changed woman. She was then a fearless leader and a pioneer, and she went on to organize 60,000 artisans in this very desert area, where now the traditional craft skills have become the livelihoods. It has stopped the migration of these 60,000 families. It has completely transformed the area. They brought in watershed development, they brought in health, they brought in nutrition, they brought in rainwater harvesting, and that's how it has generated employment opportunities, not just for the women, but for their households as well. And therefore, we very firmly believe that, organizing is the surest way to fight poverty and to build the leadership skills of women. I can give you hundreds of examples of women in Gujarat, in Rajasthan, in Madhya Pradesh, in Assam, in Jammu and Kashmir, and also in our neighboring countries of Afghanistan, Sri Lanka, Nepal, where we have been organizing. And today, I think it is these women who are spearheading the movement of SEWA, the Self-Employed Women's Association.
Thank you. So, with your don't know mind, think about the people that you heard talk about women's leadership and ask yourself whether the things that they said were more insightful than what you just heard. And ask yourself how they talked about women's leadership, because I think you'll find that they talked about it as a program, and they talked about it as a partnership, and they talked about it as, you know, this big organization getting together with this big organization and educating the women. And what Rima just told you is that's not the right model. That's not even close to the most innovative model. That's not even close to the most scalable model. So we have an opportunity, and I would suggest that India as a country has the best opportunity of any country in the world of changing that thinking, of engaging with organizations like SEWA and like Sagar Mitra, not as their program providers, but as their scaling partners. So, one of the toughest challenges in this country is health. Every aspect of health. We could have 100 speakers here, each talking about their disease and their problem and their challenge. And as aspirational as this country is, that aspiration is continually undermined by a cynicism about what we could really accomplish. Shelley, tell us how we can change that.
David has rightly said, there are many, many challenges. And the first thing we have to do is to find a focus. Otherwise, one will be totally bogged down. Sir Robert Koch, the father of bacteriology, who got the Nobel Prize for Medicine in 1800 something, he said the enormity of a medical problem depends on the number of people it kills. And that is how I chose my focus, tuberculosis. In the past 2 centuries, 1 billion people have died of TB. Less than half have died of all other pandemics combined, including smallpox, cholera, the plague, Ebola, etc., etc. And TB is not just a disease with 9 million new cases a year. It's a huge socio-economic problem. It is estimated that the world will lose $3.4 trillion in the coming decade because of this one disease alone. Now, TB eradication was one of the Millennium Development Goals. It's still our goal. It's India's biggest public health crisis. It's the only disease declared to be a global emergency by the WHO. Why is this so? It's a fully curable problem. The medicines have been around for decades. Every government has a TB control program, everything for free, huge infrastructure, huge number of hospitals, millions of dollars pouring in the country. Why this sorry state of affairs? The reason is, let me quote my professors in medical school who used to say, if you have a finger on the pulse, you can identify the missed beat. So when I started work in 2006, choosing TB as my focus, I tried to find out what is wrong. To find the missed beat, to find a low-cost, sustainable solution, that is what innovation is all about. And I found that the patients have to go 60 times, stand in lines for the better part of the day, for 6 months, every day, day after day, to a designated center that could be 10 miles away. And where is the bus fare coming from? Where are the jobs? In India, patients are losing an unbelievable $300 million a year because of TB alone. And there is so much stigma. Women thrown out of school, women thrown out of homes, 300,000 children a year thrown out of school. Nobody wants to accept they've got TB. So with that came the solution, that of doorstep delivery. And that solution has given us great results. What we have got is a cadre of foot soldiers who belong to the communities they serve, deep in disadvantaged areas. We've got these people trained in doing TB treatment. So in the nearest temple, in the mosque, in the small shops, boxes of medicines are kept for the patients. They go, take the medicine, they give a fingerprint on the e-compliance terminal, the technology devised by Microsoft Research at the same time. And in real time, we know that the patient has come. If the patient has not come, the provider goes to the patient's house, gives the medicine, retrieves the patient, repeats the education, and gets a cash incentive for doing so. And this is why technology is such an enabler. Otherwise, the patients, the providers, health workers could just be having a merry time and not doing the real work. This ensures the work that is done. We started with one center in 2006. Right now, I'm serving 7 million people in 9 states of India. We are doing 20% of the work in Cambodia, and our work has been replicated by third parties in Uganda, Peru, Afghanistan, Kenya, the Dominican Republic, and discussions are going on in other countries, Romania, and Philippines, and Tanzania, to name a few.
Thank you. So again, part of what's keeping us from moving forward is we're conflicted about what makes us feel good. You made that point brilliantly. Unfortunately, our solutions for avoiding that conflict, more often than not, make the problem worse. And this is a perfect example where the world is full of large global organizations. They're called the Global Fund. I can assure you Abbott participates in the Global Fund. There's a Global Fund which has tuberculosis in the name. But we're conflicted about what we should do with that money. And the outcome of that decision process is we don't give it to Shelley. And that is a massive mistake, because the money should go directly to Shelley and not go through a single other administrator anywhere on the planet. And we make advertisements and we tell the world that people are dying of tuberculosis. It makes us feel good that we told the rest of the world, but they're still dying. For one advertisement, Shelley can save actual people. There are problems where awareness and campaigns are virtually irrelevant. This is one of them. You have a prime minister. Your prime minister has looked at your country, and he and probably a bunch of McKinsey consultants have said, what's the aspiration that our country needs to get out of this cynicism? What did he choose? You've already heard. It's already been talked about. Does everybody know what he chose? Is everybody loading that into their don't know mind? I'm going to ask Abhijit to talk about just one of the examples bubbling up from India's innovation capabilities that aligns 150% with what your Prime Minister is asking you to do.
Thank you, David. Today, when Mark gave the talk, it took me back to the year 2008 when we started working on this concept. At that point of time, we were distributing microinsurance. I don't want to talk about microinsurance, but when we would visit the villages, we would see people defecating in the open. And the thought came up that we all know that sanitation is linked to better health. So if people do not defecate in the open and if health goes up, then my company, the insurance company that I was working with, would gain because mortality rates would go down. And since we were working with microfinance institutions and NGOs, financial inclusion was the low-hanging fruit, so to say. So we conceptualized this project using microfinance as a tool to drive sanitation. The initial model was like this, that we would work on the demand side with our NGO partners, thereby also improving our engagement with the partners that we had. And address the demand thus created for sanitation through microfinance loans. We also wanted to introduce at that point of time, and we still do, a health insurance product which could map and see the mortality that, that gets reduced over a period of time because of better sanitation. And, the same logic would also apply to your health insurance company. Their claims would go down over a period of time. So it was actually a win-win situation for both. Over a period of time, we added a third component to it because we realized that for scaling it up, we required supply chain solutions. We had been working with other agencies till then. The current model is that Finish works on the demand side. It also does financial inclusion, bringing in banks, cooperative financing, microfinance institutions, and also the government subsidies. We have set up a company which provides supply chain solutions, and we use technology tools to do effective monitoring, and thereby we have closed the loop on sanitation. Now we are working on the reuse side, wherein the resource recovery can be done, because, for example, phosphate is a finite resource. Human feces has a lot of phosphate in it. So can we recover that and address the subsidy bill that India has? This is currently what we are working on. Thank you. Yeah. We are present in 10 states today and have provided almost 500,000 families with sanitation facilities.
So, to understand the scope of what's involved here is really mind-boggling. And if you go back to Mark Kramer's speech and you walk through the advantages he said shared value could bring, the ability to figure out how to operate at scale in this case is one of the critical ingredients. And Abhijit's team know a lot about that. And often as corporations, we think, we're going to pull together our best folks and we're going to figure out a solution to this problem. And let me be really blunt. You're wasting your time, okay? Pull together your best people, but pull together the people that Abhijit tells you to pull together, because he can tell you what's needed to scale this thing. And it'll take you 2 years to figure it out. And that's all wasted because he can tell you tomorrow. And then pull together your best people to do what Abhijit tells you to do. I know it seems weird, but that's the way it works. The way we currently do it is backwards. So if we want to go to scale on sanitation in India, what we need is global corporations and India corporations as scaling partners. And there's 4, 5, 6, 7 organizations across the country that have different models and different approaches that all need to be scaled and competed against each other. And out of that will come a set of services that will get you where you need to go. And it's $1 billion a state. It's $1 billion a state that we have to aggregate. So this is going to take the best work of everybody in every sector across every space, but you have to get your direction from the people who know how to solve the problem. Susan. We just came from New York. There were a god-awful number of conferences, presentations, people, everybody standing up and saying the same thing. We need $4 trillion a year. They call them the Sustainable Development Goals, but then the request is unsustainable. So, it's, how do you close that loop? So as a corporation looking at that challenge, looking at what you've heard from these leaders, how do we change how we partner, how we engage, how we come forward as partners and really access the talent that these folks are accessing that usually doesn't get accessed by our normal public-private partnerships? And what can we do as groups of corporations to come to the table and say, for a $1 billion estate problem, we need something on steroids that doesn't really exist. How can we move in that direction?
I think the first thing is to just automatically change the way that we view partnerships. I know for us, Abbott has been in India for over 100 years, and we've been working with NGOs for years, but it's been a transactional partnership where it's been a lot about philanthropy and doing good in communities. And as we entered this sphere of shared value, it's totally flipped that model on its head. And now we're working with our NGO partners to bring them into our value chain. And so we truly believe we don't try to bring our best together and solve the problem. We want to work with these individuals and figure out how do you create solutions on the ground. And so it's bringing the partners into the value chain, thinking about not just that grant or giving that money, but really trying to figure out how to solve social problems at scale together. And that's really the only way that these SDGs are going to be achieved. If we look at innovative models of partnership, bringing the best of all of the organizations together, looking at how we can tackle the issues together.
So we only have 5 minutes. I, of course, have a whole nother round of questions, which I'm obviously not going to be able to ask. And these people would be absolutely brilliant in answering them. So if any of you want to know what those questions were, come up to me during the day and I'll share them with you. And then you can go and ask them and get the answer yourself. So I want to tell just a really quick story, then I want to take 3 questions, and each question is going to get 1 answer from one of the panelists, whoever's best to create it. So if you want to be one of those 3 questioners, get your hands up now and bring the mics to the 3 people while I tell this story. 5, 6 years ago, an organization which I will not name had a group of corporations who came together and said, healthcare is one of the biggest problems in the world. And so we, as a forward-thinking, big, rich group of companies, should figure out, we should do a study. And they decided to go look at every healthcare delivery model in the world. And fortunately, there was an organization that already put together a database of all these programs. And so that made it possible for them to convince McKinsey to do the study, because most of the work was already done. So McKinsey came in and looked at every one of these programs. And they picked 50 of them globally. And they put them forward and they said, these are the 50 best programs. ReachScale works to find the partners to scale most innovative social enterprises. So I went to the leader of this organization and I asked him, are you going to do the next step? And he said, what's the next step? And I said, well, you've got the database, you've had McKinsey study the best programs, you've got a list of 50, you know which countries they're in, you've got a group of global corporations who've already said they're interested in this problem. Why not pick the best 3 or 4 out of the 50 and take them to scale? Test them at scale. Because you never learn how to scale till you test at scale. And he said, our organization isn't a convener. We're not a doer. And that study's been sitting there for 4 years. And tomorrow, a group of global corporations could get together and do that. And we should. But we haven't. So that's the story. So the questions, 3 questions. Who has the mics? You have a mic? Okay, go ahead. Brief.
Very brief. Thank you very much. My name is Bramley. 15 years ago, I was appointed by Prime Minister Vajpayee as youth rep for India to the Millennium Summit. And we had 5-10 minutes to speak to the General Assembly, and our lobby was to create meaningful employment opportunities for young people as target 16 of goal number 8. Now, we were the MDG generation. Now you have the SDG generations with 17 goals. My question to you is, how do we meaningfully engage young people, especially young women in this country, in executing or implementing, in partnerships with NGOs and local authorities, the 17 goals that have just been adopted by the 70th anniversary of Millennium Assembly of the General Assembly? I asked this question when I was with David at the Global Engagement Forum, but that was more global. about the young people.
So,
But
so
the-
I want to hear Rima's answer to that question.
Yeah.
So think about that. Who's got the mic? Second question?
Okay, maybe maybe I'm overlapping there. My question was also directed to Rina. Seva is one of the most successful livelihood opportunities models that have taken place in India. Are you open to incubating? Because I'm working with a lot of cooperative societies and self-help groups. I represent CSR and sustainability consulting firm. So are you open to incubating and helping other models like this to emerge? Ma'am.
Third question?
We just have two questions.
Just two? Okay. Oh, here, we have one more over here, Amit. So, Rima, why don't you talk to both those questions, and then if we have time, I can get one other comment on the SDGs.
Hello, my name is Shudip Mukherjee. I'm representing GOAL. We are also working in the sanitation part, so it will be really good to hear something about the behavioral change, because we are facing a lot of problems. After constructing sanitation facilities, behavioral change is a huge problem. So, if we know a bit about that, it will be really good.
Okay, so we'll have Abhijit respond to that.
I'll be very quick, but I think, let me make one thing very clear to all of us here. Poor do not need charity, and poor will not wait for us to go and do something for them. So I think for the poor, their day-to-day survival strategies itself call for a lot of innovation, and therefore innovation is a part of their survival strategy. For us, innovation is something like a luxury that we all think very proud of, but for poor to survive, it's their day-to-day strategy. They have to continuously innovate. And I think that's what we all need to really understand. These MDGs and SDGs make no sense when you go to the women or to the poor. I think they have to carve out their own path. And therefore, I think what really means and where the call for action is that how do we invest, how do we partner in building institutions of the poor? Poor are not a commodity. They have innovating day in and day out. It's just that how do we invest in building their institutions? How do we partner in sharing the risks? And how do we transfer technology, transfer systems and processes that will help the poor themselves to go to scale? It will equip and enable them to move out of poverty. So I think that is what, if we really want the SDGs to make meaningful translation into addressing the health, that's what my colleagues were here talking, all of them, about, health or nutrition or access to energy or whatever the 17 different SDGs are. And to my sister, definitely I think we are committed to a cause. And wherever there is a cause and wherever we could really share our knowledge and experiences, we'll be happy to. Thank you.
I'm going to suggest that Abhijit talk to you directly because we're out of time, and I want to thank you for your attention, and I want to ask you to think about how to scale the most innovative models to enable people to solve their own problems.
Thank you.
Thank you.
Thank you.